I'm so proud this morning, this afternoon, to address Greater Masaka, one of the local maternity systems that I've come in love with. Because of Ssenyondo, he joined us late, but he took up so fast. Thank you, Dr. Ssenyondo. Let's clap for him. I like his approach. He's more direct than me. He's very direct. He even tells you, why are you sending us this? I like that kind of approach. And it's not in a rude way. It's not rude, our dear midwives. It's not rude, our dear doctors. But it's a transformative. We wanted to do business differently. We wanted to be honest with ourselves. To say, if it is black, call it black. If it's white, if it's not out of order. Dr. Ssenyondo, thank you so much for leading that revolution. And we're on the right path. We clearly know where we are going, and we shall get there, God being our helper. I know my coming here was to address the broader health issues, to use the pre-eclampsia day, but to address the broader health issues in the docket of maternal and child health as the commissioner. I really want to appreciate Greater Masaka. I know the director has mentioned a number of challenges, but our message this afternoon is going to be, who else are we leaving behind, and how do we get lower? I want to appreciate the gentleman who represented Living Goods. We need to sync our information to the communities. Our information must go down to the communities. The other day I was very happy to see one of our local maternities, a neonatal systems, I think it was covered. They took the message to the market. And if you go to the market next time, I'll also come. I don't know which one is the biggest market here. So that we leave the comfort of Boma, we leave the comfort, we go to the market. Those who want to hear will hear, even those who don't want to hear will hear. The beauty of the market, even the bystanders, the people who have come for the shopping, they will also hear. So I want to encourage us that we need to take our message outside our medical confines, our medical fraternity. These mothers, like our sister who has just been here, they come from communities. And she brought out a very good message. When they gave her medicines, probably we did not explain enough. She left the medicine. I think those who heard her story. That was a very important message. That there are so many like her who give them treatment, they don't know why the treatment is given. They end up leaving the treatment. But we have an obligation to go out and explain more. We can't do it alone. Our dear midwife, the issues or the complications outside the medical fraternity are so many. We need to have a system that goes beyond this. I want to thank Bukoman Sibi. I don't know how your Choose program is working. Bukoman Sibi is here? Bukoman Sibi. I want to challenge you to show the difference because you have Choose. I think Bukoman Sibi has Choose. We want to challenge you and we want to see that the whole country gets Choose. Dr. Ssenyondo, get interested in Bukoman Sibi. Are these Choose really working? Is it making a difference? If Bukoman Sibi succeeds, then we shall have resources for the entire country. The president started with the Bukoman Sibi and the leader as pilot districts to see do these Choose work. Is there a difference between Kalungu and Bukoman Sibi that doesn't have, or they are all posting the same results? So that's very important. On a broader, and I wanted our, don't disturb my midwives. People with the banner, don't disturb the midwives. I wanted them to hear this message, and it's for all of us. Dr. Dan, I think you remember one time I told you, but these mothers are not dying because of preeclampsia and bleeding. And I mean it. Actually, the cause of death is not preeclampsia, the cause of death is not bleeding. You must be wondering what I want to say. The leading causes of maternal death are two. The leading causes of maternal death, my dear midwife, you are tired, listen to this message. Number one is misdiagnosis. Dan, is that true? Number two, wrong intervention. Those two contribute 60% of the maternal death you this country. If it is PPH, it is misdiagnosis. If it's PET, misdiagnosis. Now, do you blame PET or misdiagnosis? So misdiagnosis means that you got it wrong, but it's not a problem because this is science. We have greater room for improvement.